Hello. My name is Bahati Munyampundu, and I'm a student at Ohio State University. Software department. So I'm here by presenting assignment today. And this assignment is about comparative of how system inequality, how system iniquities and disparity burdens of HIV/AIDS in US and South Africa. So the presentation has 20 slides, and each slide is going to be explained. But before I start, I want to let you know that this presentation of mine is going to take more than take less than 10 minutes. It has 20 slides, as I said before. Then it has 3 parts. There's introduction. There is paragraphs, bodies, and there is conclusion. And in the bodies, we're going to find the United States. We're going to talk about United States. We're going to talk about South Africa and compare about health system inequities and disparities, burden of HIV/AIDS in their communities. All right, so let me start by telling you that the topic is health system inequities and disparities, burden of HIV/AIDS in the US and South Africa. The purpose of this title is just the purpose of this of comparing health system inequalities in the disparity of HIV/AIDS in US and South Africa is multifaceted and crucial for addressing global health inequities. Now, let's start by introduction. On the introduction, you're gonna see a picture that's showing what is the health disparity, and the picture is gonna display exactly the meaning of disparities, and you're gonna see some photos, people, and some percentage there. Now, it's a significant health problem that offers a comparative lens between the United States and South Africa is healthcare inequalities and its impact on the burdens of diseases like HIV/AIDS. While both countries face challenges in healthcare access and disparities, then context and severity differ considerably. Slide 3. So when I talk about now South Africa, let me talk about now. Let us see the disparities in America or United States. In the United States, disparities in healthcare access and outcomes are often tied to social economic factors, race, and ethnicity. For example, of Blacks, African Americans, individuals face higher HIV diagnosis and prevalence compared to other groups. Moreover, a study revealed that African American and American Indian have higher age specific death rates compared to white individuals across various groups. You may find this in a National Institute of Health. Now, despite advancements in healthcare, access remains a challenge for many due to factors like lack of health insurance and higher cost of care. While US has seen a significant decline in HIV-associated mortality due to effective treatment and prevention programs, HIV continues to disproportionately affects specific population, particularly minority groups, according to the CDC. So on this one, you may understand that Black American and American Indians are the people who are facing issues of death due to this kind of disease, HIV. And it concerns saying that the US has seen a significant decline in health-associated mortality due to effective treatment and prevention programs. But HIV continues to disproportionately affect specific population, particularly minority groups, according to the CDC, which means minority group are people who are facing much problems with these disparities. Going forward to slide number 4, we're going to talk now about South Africa. Now we're going to see that South Africa, but before we go there, you're going to see there's a picture here showing health workers protesting in South Africa, demanding a community health workers to be taken care. But let me go on now and see how the disparity is in South Africa. It says South Africa grapples with profound healthcare inequalities, largely stemming from the historical legacy of apartheid and persistent socio-economic disparities. The country operates with a two-tied healthcare system where a well-founded private sectors caters to a minority of the population, while the underfunded public sector serves the majority. Now, access to healthcare service in particular limited for marginalized communities, especially in rural areas, due to geographical isolations, inadequate infrastructures, limited resources, and economic constraints. This is the problem. South Africa carries a disproportionately high burden of global HIV epidemic, with the highest number of HIV infections in the world and higher disease prevalence. This has had a devastating impact on the health system and overall life expectancy. The HIV/AIDS epidemic affecting the country's health profile, contributing significantly to disability and premature death. So this is how people are being affected, especially when it comes to HIV epidemic. It's affecting the country's health profile, and is contributing in significantly to disability and premature death. Now going to slide number 5, we're going to talk about comparative analysis here. Now we're going to see how both countries compared. It says both countries demonstrate a strong influence of social determinants of health on health outcomes. However, in South Africa, those factors are deeply intertwined with historical inequalities and led to a more severe and widespread impact on health and access to care. South Africa faces a much greater burden of HIV/AIDS compared to the US, particularly in terms of prevalence and impact on mortality. Now, the US has a large privately driven healthcare system where insurance coverage is paramount for access to quality care. North Peterson KFF Health System Tracker. In contrast, South Africa's dual system creates a stark divide in the quality and accessibility of service based on income and insurance status. Slide number 6 is going to show us how the problem is being addressed. And here you're going to see a picture that shows us the impact of HIV affects the impact of HIV, effect of HIV/AIDS on individuals, families, and household. But now let us focus on addressing the problem, how South Africa is addressing the issue. Here it says that South Africa is now actively addressing the health system inequality and HIV/AIDS disparities through a multi-project approach. This includes implementing the National Health Insurance scheme, strengthening primary health care, focusing on human resources for health, and tackling HIV-specific challenges like treatment access and prevention of mother-to-child transmission, which is very fantastic, very good. Now let's go to the next 7 and see how America addressed the issue. Here it's saying that here it's showing that the US addresses health system inequalities and HIV/AIDS disparities through a multi-pronged approach, as well as South African government focused on prevention, treatment, and addressing social determinants of health. The key strategies include these are strategies that US uses to address the problem. The key strategies include expanding access to testing and treatment, implementing targeted prevention programs, and tackling the root cause of disparity like poverty and lack of education. I think this is very wonderful because sometimes people we used to forget that poverty and lack of education can be the root problem or the trigger of our issues that we are facing in the world. Especially when you are poor, this is when you find that people are being selling themselves to get money, selling themselves for living. And again, lack of education can be one of the cause trigger. So I think America is doing good, and this is very wonderful. I may encourage the government to continue doing this because this is wonderful. This is a good policy. This is a wonderful policy. Yeah. So going to the next one. Next one is gonna talk about impacts of the problem on people. And I'm not gonna talk about much. I just put some pictures here. Um, where you can see there is disparities in new HIV diagnoses, disparities in use relatives in need, and racial, ethnic disparity, and so on. So let me just keep this one and go to the following one, which is 10, and see exactly what should be done to deal with the problem. What can be done? I think this is like a suggestion, or everybody can have a suggestion on this one. What can be done to deal with the problem? Because the problem is causing problems around here. People are getting some diseases, people are dying. We need to find the way to avoid this. Now, here it says, as mentioned above, addressing this problem requires a multi-project approach that focuses on both the health system itself and the broader social, economic, and the political factors that contribute to those disparities. And by addressing the factors that contribute to HIV disparities, strengthening health system using innovative interventions, fostering international collaboration, progress can be made toward a world without HIV and AIDS, and ensuring that everybody or everyone has the right to health and well-being. I think this is a good idea, and this can help once someone has the right on health and the well-being, then there will be no problem in this world. And America gonna be good, South Africa gonna be good. So this is actually for both countries that I'm talking about, South Africa and America. So we need our people as human services workers, as social workers. I think we need our people to be well. We need our people to have rights on their health. But if now the policies are avoiding us, then there'll be uh, any um, any goal, any success. So it is good to apply those strategies and let people have the right on their health and well-being. So down here there is a picture that can show exactly uh, what I'm saying. The inequalities include racism, incarceration, LGBTQ discrimination, police violation, poverty, houselessness or homelessness. Those are all public health issues that disproportionately affect Black communities. Remember, we talked about people who are facing with the problems, people who are facing with these issues, um, Black Americans, communities, and Indian Americans. So this should be end. This should be end. This should be end for people to have the right on their health and well-being. Because if someone is being incarcerated, or racism, or discriminated because of his LGBTQ or his color or his what, is gonna affect his mental health, mental status, or bring some problems. So this is why we need to be careful and respect somebody's dignity. Let people be well. Let people have the right on their health. Going forward is 11 slides. The 11 slides talks about prevalence. So slide number 11, talking about prevalence. This prevalence, before I talk about prevalence, I posted a photo here, or a NAD, that shows AIDS in South Africa, how it's affecting people around Africa, and including South Africa. I didn't mention Africa as South Africa only, but I mentioned Africa, the entire continent. The entire continent has the way the HIV is affecting people. But right now, we are talking about South Africa and America, or United States. Now, let's see now the prevalence, how it is shown here. Now, it's saying the HIV epidemic in South Africa is heavily influenced by disparities within its health system and broader socio-economic inequalities. Overall, HIV prevalence 2022 shows that approximately 13.9% of South African population, about 8.45 million people, lived with HIV. Adults 15 to 49 were affected. Oh my gosh, this is not fair. So this is 2022. Now, in 2021, before 2022, around 8.2 million people were living with HIV, and the adult age 15 to 49 years old were 19.6% living with HIV. Oh my goodness. HIV prevalence varies considerably across different provinces. So, which means in South Africa, there is more provinces, right? But now the way the HIV is different depending on the provinces. So, which means province has its number. Each province has each number of affection. But here, it's saying that, for example, in 2019, the province called KwaZulu-Natal had a prevalence of 27.0% among adults aged 15 to 49, while the Western Cape had a significantly lower prevalence of 12.6% within the same age group, but the highest risk of HIV is observed in Eastern Cape. So you see, they are trying to show us how in South Africa, the HIV is not the same in provinces. And they ended by telling us that KwaZulu-Natal and Western Cape, there is the way people are affected. You can see that KwaZulu-Natal, people affected are many, high number. But Western Cape, the number is down. But when it comes to Eastern Cape now, the Eastern Cape, they did not specify the number, but they tell us that the Eastern Cape has a huge number of people that are affected by this disease. You can see that Eastern Cape is the highest risk of this type of disease. Now let's see the next slide and see about America, US. As said above, health system inequalities, health system inequities and disparities in HIV and AIDS in US disproportionately affect specific population. This issue in America does not affect all the people. You see, this is now different to South Africa. In America, it's not affecting all the people, specific population. It affects specific population, particularly racial and ethnic minorities, gay, bisexual, and other men who have sex with men, transgender individuals, people who inject drugs, old adults, and people experiencing homelessness. Those are the people most being affected by this problem, this disease. Although 12% of the US population accounted for 39% of HIV diagnosed and the 40% of population living with HIV in 2022. Oh my goodness. Accounted of 26% of people living with HIV and 32% of new HIV diagnoses in 2022. Oh my goodness. Both Hispanic, male and female were significantly more likely to have HIV and AIDS compared to no-Hispanic white individuals in 2022. The social determinants that contribute to those disparities. The social determinants that contribute to those disparities are poverty and homelessness, insurance coverage, geographic disparities, and stigma and discrimination. Those are the determinants that are causing people have the problem of HIV and AIDS. So this is America that I'm talking about. So you found this issue of insurance. Yes, indeed. If you are homeless, to get insurance is gonna be hard. If you are poverty, insurance you can get through Medicaid, you can get Medicaid. And again, there is a stigma. People are facing with stigmas, thinking that because I'm from here, I cannot get this one. Then you just sit down because you don't feel like you can get. This belongs to those people. I cannot have this. Then you sit down, you spend home. Then you find yourself involving in a lifestyle that is not good. then you end up in facing some issues like this one. So being homeless, this can be also cause some problems like this. Being discriminated, this also can be the trigger, can be a root cause of being affected by HIV. Oh my goodness, God help us. Okay, so going forward, we're gonna talk about impacts on outcomes. What is the impact on outcomes? This is slide 13. The impacts on outcomes. Those disparity or social determinants now, like poverty and homelessness, insurance coverage, stigma and discrimination, and geographic disparities impact health outcomes for people with HIV. It causes treatment gap, later diagnosis, and an increased mortality. Yes, indeed. Because of this determinant, people are dying. The homeless are dying on the street. People are dying because they don't have insurance. People are dying because of geographic disparities. People are dying because of discrimination and stigma. People have stigma, and this can cause you have mental issues. Then you end up having some problem with health. So this is the outcome, the impact that we have, and this is where the government, the above government, need to work hard and provide the better policies that can change life of their communities. Going forward, both countries demonstrate the strong influence of social determinants of health on health outcome. However, in South Africa, those factors are deeply intertwined with historical inequalities and led to a more severe and widespread impact on health and access to care. South faces a much greater burden of HIV/AIDS compared to US, particularly in terms of prevalence and impact on mortality. Yeah. The US has a large privately driven, as we said above, healthcare system where insurance coverage is paramount for access to health, to quality care, not as noted by Peterson KFF Health System Tracker. The contrast, South Africans' health system creates a stark divide in the quality and accessibility of services based on income and insurance status. Yeah, I think we have said this one before, and we have seen that social determinants is always a problem. Social determinants is becoming an issue in our communities, and this need to be dealt with. Yeah, so people are losing the rights on health. People are being homelessness. People are being facing different circumstances due to this social determinant. Now, what's the government's role? Let me see now. What do you think can be government's roles in this issue? Here it says that government should, I think this is like a policy. Government should continue to play a role in safeguarding public health and curbing the spread of HIV/AIDS by enacting and implementing comprehensive strategies that address various aspects of prevention. Now, what strategies do you think government can implement, can use? I think strategies like implement and enforce robust policies and legislation, invest in comprehensive prevention programs, ensuring access and equitable treatment and care, then investing in research and development, but promoting international collaboration and partnership and so on. I think this is a good policy. This can be a good one to help deal with the problem. Yeah. Now going to slide 16. Slide 16 is gonna say, what should people avoid to stay away from health system inequity and the disparity burdens of HIV/AIDS in US and South Africa? Okay, so before I talk about this one, I posted a picture here, and these pictures is talking about many issues, general social, economic, culture, environment conditions. Now it's talking about living and working condition, work environment, unemployment, water, sanitation, healthcare services, housing, talking about agriculture and food production, talking about work environment, and talking about education. Now, social and community network, individual lifestyle factors, those are the things that we should focus on to avoid being affected by these issues. Okay, now, the here that talk unemployment. Unemployment can cause issues with HIV, as we saw poverty as a determinant, social determinant. Then we need to find a work, something to do. Working is a good. Have money in the pocket, have food on the table. You need to work, because if you don't work, then you will find yourself selling your body. When you start selling your body, what's going to happen? Contaminated, having HIV, which is not good. When it comes to living and working condition, that's the same. Where are you working? What are you doing? You should know. Work environment. Where are you working? What are you doing? Yeah, you should know that. Now, when it comes to water and sanitation, yeah, something like that. Now, healthcare service. Do you have healthcare? Do you have insurance? Why not have insurance? Why not have insurance? Question for you. Housing issues. I don't want to be a homeless, because if I become homeless, I may be contaminated. I may have this disparity. This one may affect me. So what should I do to help keep my house? Pay rent. Are you going to pay rent? If you don't work, find a work. Avoid unemployment. So this is just a picture. This is such a picture. Now, agriculture and food production. What kind of food do you eat? What kind of food do you produce? Those kind of things, right? So this is a picture that I put here that can just assist us to better understanding how to deal with social determinants. Now, let's go on. Now, achieving health equity and eliminating HIV disparities requires a multi-pronged approach that take us systemic issues, expanding access to comprehensive care and prevention, and challenge discriminatory practices, and beliefs. By avoiding perpetuations of stigma, neglect of education, and prevention, creation of healthcare barriers, and overlooking social determinants, progress can be made toward a more just and healthy future for all. I think this is just like an advice what people should do, deal with, be care of, to keep their health better. Now, going to slide number 17, we're going to talk about suggestion. This is my suggestion. So before I go to my suggestion, you want to see a picture that I posted here. And what is talking about circumstances, treatment of STAs, female condition, male condition, and HIV prevention. This is about HIV prevention. But now my suggestion is, I believe in working together with community. That's how I work. That's how I am. Therefore, since I believe in working with communities, my suggestion on health system inequities and HIV disparity, here is my advice. It is good to recognize the crucial load of housing, address the social determinant of health, combat discrimination and stigma, invest in targeted intervention resources, and fostering collaboration and advocacy. This is wonderful. By doing so, progress can be made toward achieving health equity, ending the HIV epidemic. That's my suggestion. Now, going forward to slide 19, slide 18 is going to just talk about conclusion. Here is my conclusion now. So before I go to my conclusion, I posted a picture here, and this picture is trying to explain the meaning of health. And looking of health, I may explain this picture as three things we should look on. As population, even government, we need to keep on watching our social, our culture, and our economy. Because I think those are the three things that are strengthening our health. If you're not socialized, then your mental health is a problem. Your culture, you need to have culture. As me, example for caseworkers or people helping others, we need to have a cultural background, have cultural humility, understand people's culture, and not discriminate people based on their culture. So understanding someone's culture is better. Having cultural humility skills can be one of the key of success in protecting health. Now, again, is economy. Economy can be one of the key also, because once your economy is good, I think the homeless won't be there, because economy can be one of the weapons we can use also to fight against social determinants. Yeah, social determinants, because this social determinant is causing more problems to people. Okay, so let's go on now. Conclusion says, in conclusion, while both the US and South Africa struggle with healthcare inequalities, and their impacts on health problems like HIV/AIDS. The magnitude and underlying causes differ substantially, with South Africa facing a more systemic crisis exacerbated by its history and socio-economic disparities. So I think this is what I may conclude with. Going forward, just reference and sources where you can check all information that I said here. You can go to National Institute of Health. The website is here. You can go to HIV-related disparities and inequality in the United States. The website is here. You can go to Understanding Health Inequalities, Disparities, and Iniquities in Africa, from the National Institutes of Health. The website is here. And again, the last source is HIV prevalence in South Africa through gender and racial lenses, from International Journal of Equity in Health. So this is what I have to say right now on the assignment, and I think everybody has heard me. But what I can say, uh, uh, it is good to always focus on social determinants, because it has been shown that this is the trigger that we have. This is the cause, the root cause of our problems of our HIV/AIDS. So if we can fight against this social determinant, then our health gonna be well, and have a healthy life. So thank you very much for your understanding. And I believe if someone have a question, please feel free to contact me or send me an email to munyempundu.1@oshu.edu. That's my student email. My personal email is bahatigandhi@gmail.com. You may just email me and ask me a question. I am ready to answer the question that you may ask me. So let me say thank you very much for giving me your ears, and God bless you all for listening for the presentation. Thank you.